His blood pressure has been fine for months, so he stopped taking his medication. Now it's 192/118. What do you assess first? Today, we're covering 7 NCLEX questions on hypertension, one of the most common conditions you'll manage as a nurse. Each question starts with a realistic patient scenario. Pause when I tell you, choose your answer, then check yourself. Let's go.
Question 1. Health promotion. A 52-year-old man presents for a routine wellness visit. His blood pressure is 148/94, confirmed on repeat measurement. His BMI is 31. He eats fast food 4 to 5 times a week, drinks 2 to 3 beers nightly, smokes half a pack daily, and works a sedentary desk job. His father had a stroke at age 60, and his cholesterol is 242. The nurse identifies multiple risk factors. Which one is non-modifiable? Pause and choose.
The answer is C, family history of cardiovascular disease. Family history is genetic. The patient cannot change it. It's the only non-modifiable risk factor listed. Elevated BMI is modifiable through diet and exercise. High sodium intake is modifiable through dietary changes, specifically the DASH diet, which limits sodium to 1,500 to 2,300 milligrams per day, and daily alcohol consumption is modifiable through behavioral change. NCLEX tip. Non-modifiable is a trigger word. Scan the options for things the patient can change versus cannot change. Question 2. Pharmacology. A 48-year-old woman with stage 1 hypertension and type 2 diabetes has been taking an ACE inhibitor for 3 weeks. She calls the clinic reporting a persistent dry cough that keeps her awake at night. Her blood pressure at her last visit was 128/78. She denies shortness of breath, chest pain, and swelling of the face or tongue. Which action by the nurse is most appropriate? Pause and choose. The answer is C. Notify the provider to discuss switching to an ARB. The dry cough is a well-known ACE inhibitor side effect caused by bradykinin buildup. It affects 5 to 20% of patients. It does not resolve on its own. It persists as long as the patient takes the medication. An ARB provides similar blood pressure control and is the standard alternative. ARBs are especially appropriate here because the patient also has diabetes, and both ACE inhibitors and ARBs are first line for hypertensive patients with diabetes due to their kidney protective effects. A is wrong because food does not reduce the cough. B is wrong because the cough will not resolve, and telling the patient to wait dismisses a valid complaint. D is wrong because patients should never stop antihypertensives abruptly without provider guidance. Rebound hypertension can occur. Question 3. Clinical decision. A 64-year-old man arrives at the emergency department with a blood pressure of 196/122. He reports a severe headache, blurred vision, and chest tightness that started 2 hours ago. He ran out of his blood pressure medication 5 days ago and didn't refill it. The nurse should first assess for what? Pause and choose. The answer is B, end organ damage. A blood pressure of 196/122 with symptoms like headache, vision changes, and chest tightness is a potential hypertensive emergency until proven otherwise. The critical distinction the NCLEX tests. Emergency means end organ damage is present. Urgency means it's not. You assess for neurological changes like stroke, cardiac symptoms like MI or heart failure, renal function for acute kidney injury, and visual changes for retinal damage. In an emergency, the goal is to reduce blood pressure by no more than 25% in the first hour. A. Allergies matters for treatment planning, but isn't the priority when ruling out a life-threatening emergency. C. Insurance is important for discharge but not the acute moment. D. Sodium intake is relevant long-term, not acutely. Question 4. Patient education. A 45-year-old woman is newly diagnosed with stage 1 hypertension. Her blood pressure is 136/86. She has no diabetes, no kidney disease, and her cardiovascular risk is low. The provider recommends lifestyle modifications first. Which statement by the patient indicates a need for additional teaching? Pause and choose. The answer is B. Many salt substitutes contain potassium chloride. If this patient later starts an ACE inhibitor or ARB, potassium-based salt substitutes can cause dangerous hyperkalemia. This is a teaching moment. The patient needs to read labels and consult the provider before using them. A is correct understanding. 150 minutes per week of moderate aerobic exercise is recommended. C is correct understanding and describes the DASH diet. D is correct understanding. Women should limit alcohol to 1 drink per day. NCLEX tip. Needs additional teaching is a negative polarity stem. You're looking for the wrong statement. Many students rush past the trigger word and pick a correct one. Always underline needs additional teaching in your head before reading the options. Question 5. Medication safety. A 58-year-old man with hypertension and atrial fibrillation has been on a beta blocker for 2 years. His blood pressure is 122/76, heart rate 64. He tells the nurse he stopped taking his pills 3 days ago because his blood pressure has been great and he feels fine. Which response by the nurse is most appropriate? Pause and decide. The answer is B. Beta blockers must be tapered, never stopped abruptly. Sudden discontinuation causes rebound tachycardia, rebound hypertension, and can trigger angina or even a heart attack. This is especially dangerous in a patient with atrial fibrillation because abrupt withdrawal could trigger an uncontrolled rapid heart rate. The blood pressure is good because of the medication. That doesn't mean the hypertension is cured. A validates a dangerous decision. C implies the patient may not need it, which only the provider can determine. D, every other day, is not a safe taper. Beta blocker tapering requires a structured, gradual dose reduction over 1 to 2 weeks. Question 6. Lab monitoring. A 66-year-old man with hypertension and chronic kidney disease stage 3 started an ACE inhibitor 2 weeks ago. He returns for follow-up. His blood pressure improved to 132/82. He denies cough, dizziness, or swelling. Which laboratory value is most important for the nurse to review? Pause and choose. The answer is B, serum potassium level. ACE inhibitors reduce potassium excretion by blocking aldosterone, which raises serum potassium. This patient has CKD stage 3, which already impairs potassium excretion. A CE inhibitor plus CKD equals high risk for hyperkalemia. Hyperkalemia above 5.5 can cause fatal cardiac arrhythmias. Monitor potassium and creatinine within 1 to 2 weeks of starting or adjusting an ACE inhibitor. CBC is not directly related to ACE inhibitor monitoring. Glucose and TSH are important baseline labs, but not specific to ACE inhibitor safety. Final question. Evaluation. A 55-year-old woman with hypertension, type 2 diabetes, and stage 2 chronic kidney disease has been on treatment for 6 months. She takes her medication daily, follows the DASH diet, exercises regularly, and has lost 8 pounds. Her blood pressure today is 128/78. Which statement by the nurse best evaluates the effectiveness of treatment? Pause and choose. The answer is A. For patients with diabetes or chronic kidney disease, the 2025 AHAACC guidelines recommend a blood pressure target of less than 130/80. 128/78 is below that threshold, meaning treatment is effective. The appropriate action is to continue the current plan. B is wrong because 128/78 already meets the goal. C is wrong because reducing medication could cause blood pressure to rise above goal. And D is wrong because the DASH diet is a lifelong lifestyle modification, not something to stop once blood pressure is controlled. Stopping it could cause blood pressure to climb again. Those are your 7 hypertension concepts. Non-modifiable versus modifiable risk factors. A CE inhibitor cough means switch to an ARB. In hypertensive crisis, always assess for end organ damage first. Watch out for salt substitutes containing potassium. Never stop beta blockers abruptly. Monitor potassium when a patient is on an ACE inhibitor with chronic kidney disease. And the blood pressure goal for patients with diabetes or CKD is less than 130/80. Subscribe for a new NCLEX review every week. Share this with a classmate. Because we don't pass alone, we pass together. See you in the next one. Before you go, if this is your first time here, welcome. This channel is built around one simple idea. You don't just need the right answer, you it's right and why the others are wrong. That's how you build the clinical judgment the NCLEX is actually testing for. Every week I post a new set of practice questions on a different condition, broken down scenario by scenario. No shortcuts, no memorization tricks, just real reasoning. Subscribe, turn on notifications, and if a classmate is studying for the same exam, send them this video. We don't pass alone, we pass together. See you in the next set.